Hey everybody, Dr. Tall Paul Simon, psychiatrist. Just did a video about ADHD diagnosis and how to evaluate for it a bit. Not a real deep dive into it, but important points there that I encourage you to listen to. Now, this video is more about treatment, okay? So again, number one in addressing ADHD or concentration problems is always to figure out, is the person really struggling with ADHD? Okay. Or is it something else? You can have ADHD and other things, and that gets pretty complicated. So if somebody's depressed and anxious or not sleeping well, drinking, and they have family troubles, and they can have ADHD too. So how do you tackle all that? Well, that's where it gets pretty complicated. So number one, across the board, whether you're an adult or a kid, counseling and therapy is always important because counseling and therapy provides an opportunity or an avenue to address all these different things. Okay. ADHD, if you're just trying to treat the person's ADHD with a pill, it's not going to address all those other things. Okay. So a lot can get missed and the person can really struggle, and they just won't grow. They won't, get beyond where they're at very much. They might say, okay, yeah, my focus is better, but my life is falling apart over here. So, okay, so what do we do about that? And a lot of times if you treat somebody's sleep issues or their depression or their thyroid dysfunction, their attention and focus will get a lot better. So it's important to get all those things addressed and then almost see what's left over and say, okay, is that ADHD? And then proceed from there. Okay, so with medications, broadly speaking, there are stimulants and non-stimulants for ADHD. And those broad different classes, there are subclasses in there. So there are stimulants that can have different effects than the non-stimulants, okay? So stimulants, there are a lot of those coming out, and drug companies are pushing some of those newfangled stimulants and, long-acting versions of those. But the standard of care for stimulants is still methylphenidate or Ritalin, Concerta. Those are some brand names, and there are others, or methylene. And those are generally very effective for the vast majority of people. Okay. Now the limitation with those is that they only work on ADHD. Okay. So they're not going to help with anxiety. In fact, it being a stimulant may make it worse. Okay. So somebody who has a lot of anxiety to them, panic attacks, stuff like that. Okay. Yeah, their ADHD may be contributing to that and the stress that they're experiencing in their life, but you don't want to add fuel to the fire. Okay, they may focus better, but their anxiety and is coming out, and their sleep is worse. So, or if they have heart issues or other substance use issues, you always got to rule out substance use issues. So, with the stimulants, they are really pretty much the gold standard for ADHD. There's Adderall, Focalin, Vyvanse. There's other brand names out there and other ones that work a little bit differently. Some people, because of genetics, one may work better than the other. So there's a little bit of caution with that. Now, one thing I will say with Adderall that's very popular in adults, it's stronger, it's more, it's an amphetamine. Okay, so it's gonna push you to work, and it's going to stimulate you. It's a close relative of methamphetamine. I mean, it's an amphetamine. So anybody that takes it, regardless of whether they have ADHD, will feel more focused and more kind of on target. And on target, they used to use it and they probably still do in professional pilots and military pilots. So on target, it's kind of a funny term because, they used to go on these long bombing runs. And so they'd give them a bunch of amphetamines to stay awake and be focused for that long period of time. The problem with it is that the effect, when you titrate up on it, it will improve somebody's ADHD symptoms to a point. And then beyond a certain point, which is for most people about 20, 25 milligrams a day, that effect, that benefit tapers off, okay? And it disappears because you're on too much and people are just kind of running around. But the curious thing about it is that people's perception of the benefit continues to improve, okay? So, you have, titration up on the medication, and then the benefit goes down around 20, 25 milligrams. It disappears. but the person thinks that they're getting better and better the more Adderall that they take. So at some point, that separation, that perceived benefit and that actual benefit separate. So that's why I'm not a big fan of Adderall, especially because it has that distortion of reality there. And if you take enough of it, you do become psychotic, in fact. That's what amphetamines do. Um, so you really want to be careful with the stimulants. You know, they're thrown around a lot nowadays, and that's really not good. So you want to be careful. Now, the non-stimulants are a great option, especially for people who have addiction issues or history of addiction issue, or people who are worried about addiction issues or substance use issues run in the family. So the non-stimulants, those could be like guanfacine, Tenex, Intuniv, Strattera, Cafe. There's several of them, and there's also some antidepressants that are used for ADHD off-label as well, like Effexor, the SNRIs, which is a class of medication, and Wellbutrin. So, and there's probably others, but the non-stimulants, I prefer guanfacine, which is Tenex, which is Intuniv. Now that one is very commonly used in Europe. It's cheap. It's a very good medicine, and it's not going to bring out the anxiety a whole lot. So that's a little bit about the treatment. Hopefully you guys find this helpful. If you have further questions about ADHD treatment or evaluation, that kind of thing, please comment in the comment section. I'll try to, post another video or address that. I don't give any treatment advice, obviously, but please subscribe to this channel, and you guys take care.